Assalamu alaikum, the clinical day. First scenario, Mr. Adam Smith, 50 years old, came with complaint of walking difficulty. Please sit with him, take history, and examine the patient and address his concerns. If you're ready, Dr. Ryan and Dr. Nazia, let's start.
Yes, Dr. Ras.
Okay, Dr. Nazia?
Yes, sure.
Yeah, here you go.
Hello, my name is Dr. Ahmed. I'm one of the doctors in the clinic today. May I confirm that you are Mr. Adam Smith, 50 years old?
Hello.
Hello,
Hello.
is it Adam Smith, 50 years old?
Yes, I am.
Okay, Mr. Adam, I'm here today to ask you some questions about your health condition, examine you, and answer your concerns. Is it okay with you?
Yes, sure.
Can you tell me how can I help you today?
Okay, so doctor, for the past few months, I'm having difficulty walking.
I'm sorry for your suffering. I'll try my best to help you. Can you please explain more? When did you start getting this difficulty walking exactly?
For around 3 months.
Before this 3 months, were you completely normal?
No, not really. Before these 3 months, there was not this leg problem though. There
Was
were
not
other
what?
problems.
Other problems, okay. About this difficulty walking, is it the first time you got it 3 months ago?
Yes, this is the first time this has happened.
Okay. And when you got it 3 months back, was it sudden or gradual in onset?
It started gradually. Now it's worse.
Okay. And where is it exactly, this difficulty, or weak? Is it like a weakness type of, like causing the difficulty or something else?
Yes, I feel weak. There is weakness.
Where is the weakness exactly?
It's in my right leg.
Right leg, okay. And what about the left leg?
No, I don't think my left leg has any problem.
Okay, and your right leg, when you got the weakness, did it start at the lower part of the leg, or is it at the thigh? Can you tell?
I think it's in the lower part of my leg.
Okay. And was there any specific trigger at that time, 3 months back? Have you injured yourself? Have you had any trauma?
No, I did not have any trauma or injuries. No.
Have you noticed this weakness worse at a specific time of the day?
No, the weakness is always there.
Okay. Any change to sensation? I mean, your feeling at all?
Yes, there is some sensation. It feels like my leg is burning. I feel like sometimes, yes.
Your leg is burning.
Yes, it feels like my leg is burning sometimes.
Is it the whole leg or you mean the sole of your foot?
No, it's my whole leg. I feel the right leg. My right leg is heavy. I have pain in my right leg as well.
Okay. Any pain anywhere else?
Well, I have some back pain as well.
Okay. For how long are you having the back pain?
For around 5 months.
Okay. Have you had any back trauma or fall?
No, nothing to my back.
Is this back pain more at rest or when you are moving or walking?
It's more when I'm doing some activities. It's more with activities.
Okay. And do you feel the pain going anywhere else? For example, your lower legs, your buttocks?
Yes, I think the pain in my lower back, it goes to my leg and my buttock and thigh.
Okay. 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 Any stiffness in the back?
No, I don't think there is any stiffness.
I'm sorry to ask you, any difficulty to control your water work or your bowel?
No, I don't. I'm doing fine. those.
Any weakness in any other part of the body? Your hands, for example?
No, my hands are fine.
Okay. Any numbness or pins and needles anywhere else in the body?
No,
Okay. What about, do you have any headaches?
no.
Any dizziness when standing from sitting position?
Well, I feel weak. It's not like I have a dizziness. I feel generally weak.
Any balance problem?
With this leg problem, it's difficult to walk, but I don't think there's balance problem. No.
Any difficulty swallowing?
No.
Okay. And any past medical history I should be aware of?
Well, I had this past medical history. Yes, I am having I'm taking chemotherapy for
Chemotherapy.
my yes chemotherapy medicines, and I recently am done with my cycle.
Okay, you're taking the chemotherapy for what?
I had this prostate cancer, so because for
Mhm.
that I was taking chemotherapy medicines.
And when was the last cycle you got?
It's been like around 10 months.
Okay. Apart from this, any other health conditions?
Well, I have high blood pressure problems
Okay, for how long?
for around 8 years.
Okay. Any other health problems?
Yes, I also have some high blood sugar problem as well. Yes.
For how long?
That is also for 8 to 10 years.
Okay. Any other health issues?
No, no. No, no.
Okay. Are you on regular follow-up for the blood pressure and the sugar problem and the prostate?
Yes, my blood pressure and blood sugar, I think they are pretty normal. Yes, within
Okay.
range.
Okay. Can you show me your medication list?
Well, I'm taking some medicines for my prostate and prostate cancer, and I'm taking a low certain potassium, low certain for my high blood pressure, and I'm taking metformin for my sugar problem. That's it.
Anything else you're taking or over-the-counter medications?
Well, I'm taking some, yes, I'm taking some vitamin supplements. My pharmacist gave it to me. So that's all. Some
Okay.
supplements, because you see, I'm having this pain. So my pharmacist gave me some vitamins.
What about any allergies that you have?
No,
Any family history of a similar problem?
no, no,
Any family history of cancer?
no, no.
Any family history of not? Any other health issues?
No, just this diabetes problem that runs in my family. So my mother also had diabetes. So that's it.
Okay. Any surgeries or procedures that you have done before?
No, no.
Okay. Any bone pain?
Bone pain, no, just my back pain. That's the pain I have.
Okay, okay. Any mood problems, mood issues?
Yes, I
Subhanallah.
feel a bit down. I feel a bit down because of all these problems that I'm having. I feel a bit down.
Do you think that life is still precious for you?
Yes, no, my life is still precious. I just feel a bit down. That's it.
Okay. Any joint problem, joint issues or
No,
joint pain?
no, no,
Nothing. Okay. Any respiratory temperature?
no,
Any lumps or bumps anywhere in the body?
no.
Any weight changes?
Yes, now that you said that, I think I'm losing weight.
Okay. How much did you lose over how long?
Around 5 kgs in these few months.
Was it intentional?
No,
Okay. How is your appetite?
I'm not able to eat much. No, my appetite is, I think, reduced.
Anyone commented that you are paler than before?
No,
Any skin changes at all?
no,
Okay. Any weather preferences?
no, no, no.
Any cough or coughing of blood?
No, I'm not coughing out any blood.
Any shortness of breath?
No.
Any chest pain?
No,
Any awareness of heartbeat?
no.
Any tummy pain?
Tummy pain? Sometimes it's just some discomfort. That's it, not pain.
Okay. For how long are you having the discomfort? Same duration?
Yes, for the 3 months.
Okay. Any history of kidney stones?
No, no stones.
Okay. Any tummy bloating or distension? Swelling?
No bloating, no distension. No.
Any change in
Just
your
some discomfort. Yes. What?
Any change in your bowel habits?
I think I'm having tight motion.
You have what?
Tight motion.
You mean hard motion?
Yes, hard motion.
Okay. Any change in the color of your stool?
No,
Or black, dark stool?
no, no.
Is this hard motion alternating with the loose motion as well, or only hard motion?
Only hard motion.
Any bleeding from anywhere?
No.
Any change in the water work?
I think I'm passing more urine. Water work.
You're passing more.
Yes.
Any pain while you're passing the urine?
No,
Any frothiness?
no,
Any change in the color?
no.
Okay. Apart from this, have you had any recent travel?
No.
Okay. Can I ask you some personal questions?
Yeah, sure.
Do you smoke?
No,
Do you take alcohol?
no.
And what do you do for a living?
I'm a construction worker.
How is this affecting your life?
Very much. I'm not able to go to work because of
I'm
this pain.
sorry for Sorry for your suffering. Do you drive?
Yes, I drive.
Is this affecting your driving in any way?
It's difficult, but I can manage to drive.
I believe it's safe to stop driving for now until we get to the bottom of your condition. Is it okay with you?
Okay. Yes.
Do you have any unprotected casual relationships?
No.
Okay. Can I examine you now?
Yeah, sure.
I would like to know the vital signs of the patient.
Vitals are all normal.
Okay. I'll start examination with the affected, the right limb.
Yes.
First of all, inspection, any wasting, any abnormal fasciculations, any deformities, anything in inspection.
No changes on inspection.
Okay, then I will check the tone. How is the tone? Is it hypertonia?
Tone is normal.
Okay, what about the power? I'll check the power of the thigh, both sides.
Power is reduced distally in the right
Reduced
side.
distally. Okay.
The right side.
So distally, you mean dorsiflexion is affected or what? Or you mean
Yes. Dorsiflexion is affected.
So the patient has foot drop?
Yes.
Okay, anything at the site of the knee? Like
No.
any injury, scar or nothing, okay.
No.
What about reflexes?
Reflex patient, all reflexes are normal except for plantar reflex. It's mute.
Is mute, okay. What about clonus?
No clonus.
Okay, and sensation?
Sensation is reduced on the dorsum of the foot and mid leg.
Dorsum of foot and what? Mid leg?
Mid leg, yes.
I will add 1 minute, Dr. Ryan, so you have 2 minutes left now.
Okay. Okay. What about coordination?
Fine. Coordination is fine.
Okay, I would like to examine the back of the patient, inspection, any swelling there, any changes in
No,
the skin.
back is normal. There is just tender to touch, and patient has pain on movement.
Okay. Okay, I want to check the arms. Anything in the hands? Any changes in the
nothing.
hands, joints? What
No.
about the pulse? Pulse?
Pulse is fine.
Okay, power of the
All
upper limbs is normal.
yes, normal.
Any carotid bruit?
No, no.
Any conjunctival pallor scleral icterus?
He's mildly anemic, but other than that, everything is fine.
Any lymph nodes in the neck?
No,
Okay, we'll go to the abdomen, superficial palpation, and organomegaly.
no organomegaly, no tenderness.
Okay, Mr. Smith, what is your concern?
Okay, so what is happening to me? I'd like to know.
I highly appreciate your concern, Mr. Smith. I have a few possibilities in mind. One of these possibilities could be a cancer in your blood cells. Another possibility could be that your prostate cancer has spread to your back and is causing you this problem. So
Okay.
actually, we need to admit you. We need to run some blood tests and we need to do some investigations and scans. And we will involve a group of doctors, including the cancer doctor, the joint doctor, and the blood doctor. And we will manage you accordingly. Is it okay with you?
Yes, okay.
Meanwhile,
Okay.
please stop driving as advised. Okay.
Time is up. Examiner question. Perfect, by the way. Let's start the examiner.
Yes, so what are your differentials?
My top differential could be multiple myeloma, as the patient, supported by the history of low mood, polyuria could be due to hypercalcemia, and back pain. Another differential could be prostate cancer metastasis to the back, causing like this leg weakness. Another differential could be maybe disc prolapse or degeneration at the back.
Okay.
Yeah.
Okay, so what would be your advice for safely netting to the patient?
If the patient develops any sudden weakness bilaterally or loss of sensation to the private area or problem with the control of bowel work or urine, come back to the emergency or to seek medical attention.
Okay. Do I ask more?
Sorry?
Do I keep on asking more?
Yeah, you can
Yes,
ask.
it's still 4 minutes.
Okay, then okay, so how would you investigate?
So basic investigations, full blood count with differential and renal function, liver function panel, electrolytes, especially calcium and maybe vitamin D and parathyroid hormone, and MRI of the back of the lumbosacral spine, and X-ray as well can be considered, and serum electrophoresis and urine electrophoresis for multiple myeloma, and Bence-Jones protein and urine analysis with urine microscopy, looking at a 24-hour urinary protein creatinine ratio. And maybe because the patient is prostate cancer on chemotherapy, maybe we can check PSA levels to check for any like recurrence of the cancer or worsening in the levels. Maybe also nerve conduction study and EMG as the patient is having foot drop. I don't know what else, honestly.
Okay. Yeah, that's fine. And how would you manage this patient?
Management, disease education and counseling, multidisciplinary team approach, including hematologist, oncologist, specialized staff nurse and physiotherapist, and maybe neurologist or neurosurgery if there is any signs of cord compression. Occupational therapist as well. And pharmacological, it will be analgesia, pain support, like pain management, and then treatment of the underlying cause. If it was multiple myeloma, then chemotherapy, and if it was prostate cancer mets, also chemotherapy or radiotherapy to the spine. I think so.
Okay. And so Okay, so patient has features of hypercalcemia. So
Yeah, we
how
can.
do you manage that?
Yeah, we can also give hydration. We can consider bisphosphonate, calcitonin. We can consider steroids as well, and we can consider diuretics. And the last thing we can also consider denosumab. I think denosumab.
Great. Also, what else?
What else for hypercalcemia?
No,
something.
like what else to ask you?
What else to ask?
How do you
Okay.
investigate multiple myeloma?
Multiple myeloma. I said serum electrophoresis اللي هو SPEP و urine PEP. Serum protein electrophoresis and urine protein electrophoresis, Jones protein.
MashaAllah, you read the topic before the practice? You mentioned all the specific blood tests. Okay. Any
I
any
think
suspicious here for chemotherapy overdose, drug side effect? Is it possible to be differential? Do you know some of chemotherapy
Yes.
can cause?
what is the question again?
Any chemotherapy can lead to neuropathy. Do you know any?
أيوة vincristine بس يعني
Yeah, why not? So it's one of the differential, do you think?
I don't know if vincristine is used for prostate cancer صراحة.
Did you ask for the question
I
about the
asked
details? No, the name of chemotherapy?
لا I did not ask for the
So
name of the chemo.
it could
I
be,
do
right?
not know either. I don't know either.
Okay, time is up. Just I utilize the time for talking. Now you can comment, Dr. Nazi.
Okay, so I did this case myself to one of my mentors, and you actually did a great job with the differentials. I did not mention multiple myeloma when I did the case. My first differential was metastatic bone disease, and I asked about the job, and patient was doing construction work. So he got some disc prolapse, like heavy weightlifting is a precipitating factor for disc prolapse. So my second differential was disc prolapse. And I thought patient was having hypercalcemia because of the metastasis. And then, so also thing is that when I was examining, my mentor asked that why didn't I do the straight leg raising test? Because since this prolapse is my differential, I should do the straight leg raising test and should check the gait, because during gait, we would see the foot drop more. And you have to, since the patient has diabetes, I did not tell you my monthly, 3 monthly sugar level, but there's a possibility that it could be diabetic neuropathy. Even though it should be into both legs, but it could be mononeuritis multiplex, like common peroneal nerve palsy, something like that. So you could check the foot eversion inversion to differentiate from the L5 radiculopathy and common peroneal nerve palsy. And in the advice, you have to tell the patient to stop weight bearing. So if he objects that this is my job because I'm a construction worker, so you could involve the occupational health department, and we could advise the patient to wear a lumbar corset. And multiple myeloma is a very good differential. And also things there is a fourth possibility. Since the patient was having some medicines for his prostate, they are prostate cancer patient, usually they are prescribed anti-androgens. And anti-androgens can cause osteoporosis. So it could also be osteoporotic fracture since he's heavy weight lifting combined. So metastases, osteoporotic fracture, multiple myeloma, any of these could cause vertebral fracture leading to L5 radiculopathy. So that's it. And we could do DEXA scan, and we need to do the bedside digital rectal exam to look if the prostate cancer is back, and DEXA scan for osteoporosis or bone scan maybe. And serum, did you say alkaline phosphatase? I don't recall, but alkaline phosphatase should be one of the investigations. And serum calcium, you said, yes. So that's it. All else is totally perfect.
Yeah,
It was
I
a nice
agree with
case.
you, Dr. Nazia. She did perfect.
Thank you.
Yes,
I would
you
give
actually
you
did better than I
28
did.
out of 28, really.
Thank you. I wish you
Amazing.
are my examiner, yeah, Dr. Basim. I wish you
Really,
are my examiner.
really, no, you did it in a perfect way. From the analysis, the system review, the related system, and the constitutional. You took time, yes, but it's complicated case, as Dr. Nazia said. So it carry a lot of differential, and I think you cover all the differential apart from the diabetic neuropathy. I don't know if you ask about hemoglobin A1C. I think you missed this question only.
I did not ask it because she told me it's controlled, and I didn't have time, so I skipped it. But I remembered it actually.
Yeah.
But I just متعمدة يعني I skipped it.
Yeah.
I
But
think it's
no,
fine because
yes, it's
peripheral sensory neuropathy should involve the both legs, but it
exactly.
could also be mononeuritis, a single nerve palsy, like common peroneal nerve palsy, as a part of mononeuritis multiplex. Like diabetes can cause single nerve palsy as well.
Yeah, I agree for that. It can cause mononeuritis multiplex. And I agree to ask only one question, which is hemoglobin A1C. How is your reading for the 3 months? You will not ask more about, because she said, yes, I'm the controlled diabetes. So one question to know if she's well controlled or no, the hemoglobin A1C. Okay.
Okay.
Apart from this, really amazing case presentation, performance, taking history, the examination. Yeah, you exceed the time, but your examination was perfect from the toes down, the movement, the tone, power, reflex. As we know, do always do tone, power, reflex, coordination, sensation. And if you don't have time for complicated case like this, you can select one of the superficial sensation, either fine touch or the deep sensation, like the joint, better than the vibration, because vibration always takes time. So better to do the joint. Is it up? Is it down? That's it. Apart from that, really, I don't have comment. Just add one question to the chemotherapy. You ask the chemotherapy when and what the last cycle. If you could ask what is the medication name, it will be perfect. You can put here blindly the chemotherapy induced neuropathy. Even it's not the case, but you can put it in the differential. Right, Dr. Nazia, is it?
Yes, it could be, even though when I did the case, the patient didn't know what he got. So I would have not been able to say what medication I was taking because I don't know.
No. At least you will say, I don't know it. I don't know the name. But we have to think about it because peripheral neuropathy as a complication of chemotherapy, one of the most presentation. I mean, vinplastin and vincristin, as Dr. Ryan mentioned. So add another question. What's the name of this medication? Do you know? If he doesn't know, it's okay. Better he doesn't know, because if he knows it will be, you should put it in the differential. But if he doesn't know, also put it as a query. It could be related, but it will be, and rather than asymmetry, it could be symmetrical one. Okay. This is my comment. Any question, Dr. Znazia or Dr. Ryan, about the case?
Thank you, Dr. Basim. Thank you, Dr. Nazia.
Sorry? Anyone has concern?
Thank you.
Okay, Dr. Sarah, you're here. Let's celebrate with Dr. Sarah, her pass today.
ما شاء الله.
Yes, we will not miss this moment, Dr. Sarah. If you think we will not celebrate, we have to celebrate.
Yes, thank you.
Why? Because
No.
Dr. Sarah was one day presenting a case in the same position, Dr. Nazia and Dr. Ryan, and she passed today. And she
ما
was,
شاء الله.
discussing the case. It may be less than 1 month, Dr. Sarah, right?
Yes, less than 1 month. Yes.
Congratulations دكتور سارة يعني ما شاء الله
I just
فرحنا لك.
ربنا يكرمكم. I just want to give my feedback because I own to this group. Because I started with this group with Dr. Basim, I was very hesitating and I couldn't take a proper history. But practicing in such group, we are also all the members in the group also are helping me, and all the comments that help me. I'm here in the UK, but I got a lot of you helped me a lot. So I will just want to give my feedback about the exam and what we will do for this exam. This is my second attempt. I had the first attempt in November. I didn't pass. So I booked in February and I passed today. So first of all, this exam, the most important thing in this exam is self-confident. You need to be self-confident. Your voice should be clear, loud. You shouldn't, when you start the examination, when you start to see the patient, look at the bedside, you'll find maybe a lot of hiding, and the inspection is the important thing. Inspection will help you to get the diagnosis, the most important, more than the proper examination. So first you need to be self-confident, because also when you sound is loud and you are I studied the same as before, but the only thing that make me pass this time is self-confident. I wasn't too much self-confident, but I tried to be more self-confident, because also the examiner, they are not, sometimes they miss what you are saying if you are talking in a low voice. But if you are confident and talking in loud voice, is even if you are saying something wrong, they might considering right, because they are not paying attention to what are you saying. So the most important, self-confident. So before the exam, it's better the last 10 days or about 2 weeks. Every day, try to do the examination. The upper limb, lower limb, and then cranial nerve, abdominal, cardiovascular, neurology, and respiratory on any member of the family, or on the doll. I was doing it on the doll. I have a soft doll, and I was doing, and I'll make for myself 5 minutes. So I will do the examination to be fluent, because in the exam, if you are fluent in the examination, you will pick the positive finding. So try before the exam was 15 days, every day in the morning, do all the examination, and make it systemic, because in the exam you won't think, oh, I did the tone, so after the tone what I should do, the power. No, make it systemically from the beginning. It will be fluent, so you'll be able to finish in 5 minutes. I finish in 5 minutes, sometimes in 4 minutes, and I picked the finding. Okay, so this is important when you start to say the investigation. So try to be systemic. Say first bedside, make for yourself a scheme. Bedside examination, and say what's the bedside: ABG, pulmonary function test, urine dip, and then bedside, blood, imaging, and specific investigation. So try to keep these 4 as a scheme, because in the exam you will be very stressed, and the exam itself is the thing that helped me, because I entered this exam before. So this is give me more confidence and less stress. So in the exam you will be less, you have a lot of stress and you couldn't say a lot of things that you know. So make the scheme: bedside, blood, imaging, and specific investigation, and say any investigation of this. And the management, when you start the management, you say at the beginning, I will do multi-systemic approach, multidisciplinary team approach, and then say what you will do. Okay. For the communication, I got the full mark in maybe the full mark for 15 or 14 over 16 in both communication. I wasn't good in communication, but what I learned from here, that the communication, you don't need to have information to the patient. You know, don't need to say everything. Yes, I can do it for you. No, you should be uncertain in everything that you say. If the patient say, my mother is dying, I want to take her home. No, say, let me discuss it with the team. because sometimes it's not possible to give the proper care at home. And then I will come back to you, but we respect, that's good that you highlight these wishes, and we respect that. We'll do our best to help you with that. Don't say, yes, of course, you can take your mother at home. No, this is not the communication. Yes, the DVLA, sometimes you don't need to say the time for the DVLA, 3 months or 6 months. Say, if you are not sure, you will tell him, let me discuss it, and I will come back to you. At the end of the meeting, after finishing our discussion, I will come back to you. So in the communication, don't be certain in any diagnosis. Don't say, they doesn't need you to be certain. They want you to show empathy to the patient, give time to the patient to talk. Because in the communication, the first communication, it was a medical error that the patient son coming, angry patient, it's written in the scenario, apologize. So I know this is a medical error. It was one patient that his mother was having mastectomy, and the left mastectomy, and they shouldn't use the left arm. She was having hypercalcemia, and she was confused. So she was in the hospice, and I'm a doctor in the hospice. So the doctor insert the cannula and give her fluids for the hypercalcemia, but she was confused. She didn't say that you shouldn't use the left hand with the left arm. So the son was, and she wasn't wearing a bracelet that saying that don't use this arm. So I didn't give time to I was thinking that I will fail this patient because I didn't give time to the patient, to the son to talk. But I passed it and I got good mark. So I think it's let the patient express and tell him what we did, that this was for her best interest. We are sorry, we apologize. And from the scenario, you will know. If the scenario is uncertain and doesn't it's not written apologize or medical error, so don't assume, because there is a lot of scenario coming now with uncertainty. As the patient, the GP stopped for him medication for as a warfarin, and then he got hemorrhage or got stroke. So if it's not, if you are not certain, so you can say, I think that we don't have access to the GP record, but I think the GP has discussed it with your father, the pro and cons of stopping this medication, and then he took this for his best interest, but we can have further discussion with the GP to know what exactly happened. So try to be in between. Don't be with or against. Okay, and at the end, don't also offer the complaint. I told him, if you want to have a complaint, okay. He said, okay, yes, I want to complain. I told him yes, but let me discuss it first to know exactly what happened.
Yeah, mom.
And come back to you, because you will avoid unnecessary complaint. And then I will come back to you, and you still insist about the complaint, we can help you with a patient advisory liaison team. So don't offer the complaint immediately. Tell him that we will discuss it, and we'll have a meeting with the head of the nurse and with the medical team to know exactly what happened, and we'll come back to you. After that, if you want to complain, we will help you with that. So try, what I'm saying about the communication, try to be diplomatic. And the other communication was the mother of a son, 22 years old, has Down syndrome, and this son was end-stage renal failure. He's on dialysis, but they couldn't do the dialysis because the son is very agitated. He has Down syndrome. They couldn't take from him blood, and they took his blood when they sedate him, or if the mother is present. So they decide to stop the dialysis, and he's not fit for renal transplant. So talk to the mother. So you will break the bad news, but you try to be empathy with the mother. Tell her that what do you think, that your son will suffer more, and we will give him all the sedation, and he need to follow up with the blood. And then she asks you if he will die. You said, unfortunately, I'm sorry to tell you that he will. If you don't do the dialysis, which is washing the toxins from his blood, you explain everything in a simple way. He might be confused, and he has the toxin in his body, and he might die. But and all the time tell her that we want to assure you that we are here with you in this tough journey. We'll help you, we give you the support. So this is the communication in general. Try to show empathy to the patient. Let them express what they want. Because she asked me what about the renal transplant. I told her renal transplant is one of the options, but he need to take the medication regularly, and and he need to have a follow-up with the blood. So it will be also not a good option for him. It will help him, it will let him suffer more. What do you think? We want him to be comfortable. So at the end, she told me, yes, I want him to be comfortable, and it was good. So this is the communication. The communication is not knowledge. Here in the UK, most of the doctor doesn't know the knowledge that we know about the medication, the side effects, but the communication is not this. It's the way that you will be show empathy to the patient, and you will be in the midline. Don't say, yes, we'll do that for you. No, say we'll come back to you, and try to have some words to be ready for you. First, I'm really sorry about what's happening. I can see where you are coming from. So you can have some phrase that you fix for any scenario. Okay. And you will have some knowledge about that, about all this. So this is the communication. And as I told you, in the examination, you need to be fluent in the examination. So for my exam, I had one abdominal examination. It was a liver transplant, and the liver was felt. He doesn't have any stigma. Or apart, at the end, the examiner asked me, look to his eyes. I said this could be but he said, look to his eyes, what he's having. And I noticed that the patient had exophthalmos. He said, Graves' disease. I said, exophthalmos, yes. So he was having autoimmune hepatitis. That's why he had the the liver transplant. So have a look. Inspection is very important to know all of the things. This was abdominal. The respiratory was interstitial lung fibrosis. It was a straightforward case, but she doesn't have any other stigma of only interstitial lung fibrosis. She was having only some fine tremors. The cardiovascular, it was a patient has midline sternotomy scar, and he was having loud first heart sound, so it was mitral valve replacement. And the last one was the neuro. The neuro was a difficult case. The patient was, when I start to examine, it's written examine the upper limb. So I started the examination. The patient was have fine tremors. And then when I asked her, I said I will do the sensation. They said no need. Sensation are normal. So I didn't have anything. The patient was doing the finger to nose very quickly. So I couldn't notice that this patient has intention tremor. If she's doing this, the surrogate are very trained. She make it quickly, the finger to nose test. So I didn't notice that she has what she was touching my finger quickly, and she make it quickly. So I didn't notice the intention tremor. Other colleague said make it slowly, so they noticed that she has at the end intentional tremor. So she was having cerebellar tremor. I said it is one of the differential, but I didn't say it from the beginning. So be aware that when you do the examination, and if you, I think in this station, do the eye examination to check for nystagmus, for any other cerebellar sign. So the surrogate are very trained to hide the positive finding. This patient was hiding the intention tremor, and she was having also hyperreflexia. So you don't need to know the diagnosis in neurology case. You put differential. Okay. So this is a neurology, and is it too long clinical consultation? One of them, one patient coming from Egypt having jaundice and fever and vomiting. So it's mostly hepatitis A or hepatitis E. She doesn't have any positive find or even jaundice, but and try also to do safety netting. And say the patient need to hospitalize. This patient was having vomiting, so we should hospitalize her and give her IV fluids. This is important in the management. From the beginning, you should know before entering the station, write in your papers a long case, what is your differential, what you will examine, and safety netting also for the patient, and to manage the patient concern. Try when you start at the end of the last maybe 2 weeks, try to do the long clinical consultation on 12 minutes. Because in the real exam, you will need to examine a lot of things, and the patient can talk a lot. I have one patient was ankylosing spondylitis, and he was having psoriasis, and also he was having crepitation on the lung. So he was having Crohn's disease with ileostomy. So this patient was talking a lot, and he has a lot of findings that I need to examine. So you should know that the patient may talk a lot. So you need to adjust your time at 12 minutes, because you will do the proper examination in the exam. Now we are not doing the proper examination on the online. So make it at 12 in order to train yourself to do the relevant examination and address the patient concern, and talk with the patient and to address the concern and to know exactly the finding with the patient. So try at the end of your practice to make it a 12 minutes long clinical consultation. And if you are doing the long clinical consultation and a communication, you are fluent in these two things, you might pass the exam. In this exam I didn't have good marks in the cardio and the neuro, so but I passed because the other score helped me. So we don't need to you need to have a borderline in every stage and over
بكام يا اخوي؟
skills. So this is my advice. But the important thing, as I said, to be self-confident, really, and try to take a beta blocker before the exam. It helped a lot. And have a good sleep before the exam. Don't study the day of the exam, the day before the exam, because it won't do anything. It will put you on stress. You need to be calm. So try the day before the exam to chill out. And on the exam day, try to sleep well. Try to be confident. And also don't use your hand while presenting the case. Put your stethoscope behind your back and hold it, in order to train yourself not to move your hand or look to the patient. When you are talking to the examiner about the finding, don't look at the patient. And also I was confused to say left or right, so try to fix the heart. Okay, say the heart on the left side, so anything on the side on the heart of the patient, so it will be the left side, because I was looking to the patient in my first exam, saying I couldn't say because of confused, I couldn't say right or left. For me, I wasn't like this. So when I say that the heart, I fixate the place of the heart, so I will be able to say this patient has a left-sided, have a right-sided. So it will be also easy like this. And don't look to the patient when you are examining, when you are presenting to the examiner. And this is my all advice. And you should practice on a daily basis. And you should, in the communication, as I told you, to have a fixed phrase that you will say it to the patient, and to be I'm sorry about what's happening. I can see before answering any question of the patient, give your signpost by saying, the patient say, I my father was having cancer, I'm really sorry about that, I can see where you are coming from, I see how it's difficult for you, and then answer the question. You should put introduction and signpost, and then answer. Don't answer quickly. Yes, I will tell you what's happening. No, you should say yes, I'm sorry about that happening, and you don't give any clear information. You should say, I will go to the team and come back to you, we'll discuss it. So this is the important things in the communication, because the communication, they are bringing, if you are practicing all the communication you want. I got 2 new scenarios that I didn't have them practice them before, but because I was having a scheme for the communication, so I was able to be ready and to answer for any patient concern. So this is my all things, and the exam is not knowledge at all, and it's only self-confidence, and only to pick the finding quickly. It's not a knowledge, it's not of time of studying. So, and it also is the luck, because some people can fail with 1 mark or 2 marks, which is not fair. And sometimes you go from the exam thinking that I did this station very well, and you find that you failed this station, and other stations that you was confused, you got the full mark. So you don't need to rely on all of these things. Do practice on daily basis for the communication and non-clinical consultation, and try to go to the hospital. I don't know if you to see positive clinical findings, see what is hyperreflexia, see what is the clonus ones, and try to see the Parkinsonism has a different examination. So to know the positive finding only. And for the murmur, you should be aware about the ejection systolic murmur. Usually the ejection systolic murmur, it's like shh, and at the end you couldn't hear the second heart sound. This is the ejection systolic murmur, shh, and no second heart sound. The pansystolic murmur is constant, like this, and you will hear the second heart sound, and also from the radiation. And the exam, you should make, as they are saying, you can put the stethoscope and take deep breaths in and out. You must do that, even you are not convinced that the murmur increasing with inspiration, with expiration, but we should show the examiner that you are able to do that, and lean the patient on the left side to check for the mitral, lean the patient forward to check the aorta, as the same as the examination in past tests. You should do it. And when you're examining the abdomen, look at the face of the patient, not palpate the abdomen to see the facial expression. because all of this you will fail mark. Look to his face and examine the abdomen and make it with inspiration also. So you should be systemic. And when if you find from the beginning a midline sternotomy scar, so you know this is could be mitral valve replacement or aortic valve replacement. If he has harvesting vein graft, so you might be aware this is cabbage, not mitral valve replacement. And you will hear also sometimes the click of the mitral of the valve, metallic valve from the bedside, and sometimes you can see some bruises. So you will know that this patient has a metallic valve. So the cardiovascular examination, it's only the way that you will examine. And for the murmur, you can hear some on the YouTube there is ejection systolic murmur and the pansystolic murmur, and you can hear them. And also on the patient, get used on it. So it's not difficult, the examination, but the issue, as I told you, to be more confident and to practice on daily basis. This is my.
Thank you, Dr. Really, it's an amazing experience, and we are all happy for you.
Thank you so much. Thank you.
Yeah, and I guess all of us also get benefit from this experience.
Thank
A
you.
lot of advice, golden advice, really.
Yes.
Thank you so much.
Thank you, Dr. Basma.
Thank
And
you
thank
so much.
دكتورة سارة and congratulations a lot.
you so
Yeah,
much.
thank
توفيق
you.
فيما هو قادم إن شاء الله.
إن شاء الله ربنا يكرمكم يا رب. And thanks, Dr. Basim, for all your help. You
Most-
give me a lot of support and a lot of self-confidence. I gained the self-confidence from this group.
You
At the-
deserve it.
At the beginning, I was hesitating and I couldn't say all the and also in the long clinical consultation, we should have systemic question. So if he has back pain or any joint pain from the beginning, if you ask, we increase with movement, decrease with movement, so you will know where you are going.
Yes, exactly.
Yes, if he has polyuria, said if he has nocturia, and then after polyuria, check if he has nocturia also. So it's not. So you exclude the psychogenic, and then go for hypercalcemia. Ask about the sign of hypercalcemia. If not, so if he doesn't have sign of hypercalcemia, so you need to think about diabetes mellitus, diabetes insipidus, or drugs that can cause. So you and chest pain. So you need to know. Ask about the question about this chest pain, cardiac there is orthopnea, paroxysmal nocturnal dyspnea from the beginning. To this, the
We
cardiac.
will need your experience, Dr. Sarah, with us. If you are free, join us daily.
Yes,
And
I will join.
your feedback always will be valuable.
Yes, I will join. I will try to do my best. But
Yeah. Yeah, we give you a vacation after the exam, and now you got the result, stress free.
I'm happy to help because
Yes,
we are struggling to know what exactly, and this exam is very challenging and very stressful, and it's
Yeah.
difficult. It's not an easy thing, and passing it is a victory.
yeah. Thank you for that, and please join us if you
Yes,
can,
I will
and
do.
if you are free. Yeah,
Yes, I will do.
yeah. Your feedback and your comments will be always valuable.
Yes, thank you so much. Thank you.
Thank you, Dr. Sarah, again for sharing your experience with us.
Thank you.
Let's go to the any question before moving to the next scenario. Yes, Dr. Mahi, I
أنا
guess.
بقول لها ألف مبروك بس.
Okay.
ألف مبروك.
ربنا يكرمك يا رب. عقبالكم كلكم يا رب.
Yes, one day we will celebrate all of us or each member here, inshallah, hopefully.
إن شاء الله. إن شاء الله.
Inshallah.
Thank you so much.
It's nice to work.
Sarah,
Okay.
Dr.
Dr.
Sarah,
Azhar, a special congrats from
I'm
Dr. Azhar.
I'm very very happy, and because I was really missing you when you were not in our meeting.
Yes, thank you, Dr. Azhar. You are one of the persons that give me a lot
Yes.
of encouragement. And you told me, Sarah, Dr. Sarah, you need to be more self-confident. You are doing
Yes.
well. And you will do well because you have a good knowledge. And when you started to practice, it helped you a lot. You have a very, very good medical knowledge. So I'm sure that you will do it, but do frequent practice on daily basis. This is my advice to you, Dr. Azhar. And thank you for all your encouragement and support. You are one of the persons that give me also a lot of push from what you
Really,
comment.
you really deserve it. You really
You
deserve.
deserve
But
it. Sid.
now you will pray for us, and
Yes.
you will give us
Yes.
your practice tips. Inshallah, inshallah. Still, I'm not going to apply for any exam. I do not know. I'm not thinking for the exam. Inshallah, maybe after a few months or 1 year, inshallah, I will apply for the exam.
No, you should apply. You should, because if you want to apply, you should have a time frame and apply to, in order to, if you won't apply, you won't be regular. So you should
In-
put yourself in the situation that, yeah, I'm having exam.
Yes, exactly.
So
Otherwise, you'll be lazy. Oh yeah.
yes,
Exactly.
yes. And you
Yes,
have,
yes.
and you started, you have a good knowledge at the beginning when you started
Yes.
practice. You wasn't able to ask all the question, but now you are very fluent in asking all the question and addressing the concern. So I think now, I think you might be ready in 1 or 2 months if you put it in your mind. So
Yes.
it's need practice, and you need to have, you know, I got this exam date after 1 month of my previous exam, so I think I wasn't having time. And I asked Dr. Basim. He said, "No, take this exam." I told him I couldn't do it. He told me, "No, you will do it," and I did it because it's only 2 months, and I was having my knowledge fresh. So I built more knowledge, more experience. So I think you should have a time frame for the exam, and you will pass, Dr. Azhar. I'm quite sure you pass from the first time.
Yeah,
I'm really happy with Dr. Bassam, because if any a person is passing the exam, we can never forget Dr. Bassam efforts,
Oh, yeah,
because on this platform,
yeah,
this platform made me more confident, and I can speak and I can discuss all these things very fluently. So really, really hats off to Dr. Bassam.
yes, and he's on regular basis, on daily basis. He's not delaying any session. So thank you, Dr. Basim, and I don't know how to say.
really, I feel like I am in my family member. All of you, like
Yes,
my
yes, yes.
family member. And once Dr. Sarah sent me, she passed. I feel like I passed already. So
Yes,
yeah, and
Inshallah,
also Dr. Azza,
inshallah,
all of
in a
us,
few days,
because
inshallah, we will
we
have
are
a very happy news,
we are
inshallah.
meeting in daily basis, as Dr. Sarah said. So it's a matter of celebration, and one day you will celebrate for us, and we'll celebrate for you.
yes,
Thank you, Dr. Sarah. For those candidate whose listener newly, you can hear the practice me and Dr. Sarah in month January and also maybe December. We practice a lot of cases together the last 2 months. February, no, not February, maybe January and December, and some days in February.
yes.
So, yeah, she was perfect, and yeah, she deserved this success.
Thank you. And if you listen to me at the beginning, I was hesitating.
Yeah, exactly. Yes, she
I was
was totally
crying.
different. Yeah. I
Yes,
believe she was only dependent on this meeting. She didn't do any interaction with any other group. So that's why
And
I insist to celebrate with her this moment in this meeting.
yes. Thank you so much.
really, she was selecting the cases of communication, I remember.
Yeah.
Really,
Yes.
on daily
You
basis.
know, I'm not good. I'm yes, I'm in the UK, but I'm not. I think we adopt because we don't, is English is not our mother language. So
Yeah.
Yes.
it's here they have a good communication because they able to address the patient in different ways. So we need to. I was writing some phrases because
Yeah.
as I studied, I was writing them. I'm shy to say that, as the patient was wanted to see his mother at the end of life. So here they are saying the visiting our lifting when the patient approaching the end of life, so they can, all these families can visit him. So I wrote this phrase and I keep it in my mind in order to give the patient, to tell him that the lift is visiting our lifted when the patient approaching end of life. I said I put also I don't have access to the record of the GP. I really appreciate that I couldn't talk on behalf of my colleague. So I wrote all this. It's not to be shy to that you don't know, if you're not fluent in English, to write some phrases that will help you in the communication, and you will keep it in your mind, so you can say, I can see where you are coming from. Keep it this phrase in your. I was writing all this phrase in communication in order to give myself a learning and more vocabulary to talk with the patient, because this is they are passing, here they are not doing any practice in the communication except 1 or 2 cases, and they got the full mark in the communication because this is the mother language, and they are able to deal the patient without saying yes, a clear, or no, a clear. No, they are in between, they are diplomatic. Here, anyone when you ask
Yes, exactly.
are diplomatic and uncertainty in everything. So communication is uncertainty, and you will address the concern of the patient and come back to him. You don't need to. You are not the consultant here to take the decision. This is difficult for you. So this keep some phrases that you will say. Breaking bad news, I will put this phrase. I'm sorry, I don't have good news for you. Then golden silent, and then I'm afraid that the result. And from the beginning, if this breaking bad news, I will put it in the notes that would you want to bring someone with you if you are breaching saying the HIV treatment, that he has HIV diagnosis or any sexual transmitted infection. From the beginning, I will tell him everything is confidential, but not like this. Everything is confidential unless there is something cause harm to yourself or to the other, or we give us the permission. It's not confidentiality. You should don't say everything confidential and finish. No, if there is a harm with the patient or to the others, or this patient give us the permission, so we will breach the confidentiality. From the beginning, you will tell him like this. So you will be in between. Don't say it confidential and finish, because sometimes you need to breach the confidentiality in some situation. So try to fix some phrases and write them in the note as a communication. And before entering the station, because the exam you will be very stressful, will forget the golden silence and breaking bad news. You forget what to say, and you'll be very confused. So from the beginning, you when you practice, you have this phrase in your book, or is the paper that you are writing these phrases, and you will fix them to say them spontaneously. And as I said before, answering the patient in communication, signpost by saying, I can see how we are feeling now. I can see how it's you have an awful experience with your father. I'm sorry for your loss, and then continue. Don't answer direct. Yes, you have no. Give introduction.
That's why we need you in the practice every day to listen to your comments. Hopefully, it will help all of us.
Okay, I will try. I'll try to enter into communication. Yes, I will try.
Okay, we will wait for you. Let's call Dr. Nazia. I hope it's not late for her now. Sorry for Dr. Nazia. Are you here?
Yes, sir.
Sorry for being late for you. I know
No,
it's late in India now. So let's start straight away if you're ready.
Okay, I'm ready.
Yeah, here you
Hello.
Hello, yes.
Hello. Am I talking to Mr. Ali, 35 years old?
Yes, doctor.
Okay, so I am Dr. Zareen, one of the medical doctors in this hospital today. So I'm here to talk to you about your medical condition. So can you please tell me what brought you to the hospital today?
Yes, doctor. Actually, I've been having pain in my right hip, and this is bothering me a lot. It's a very severe pain.
I'm very sorry for your suffering. So how long are you having this pain?
Actually, it started today in the morning, doctor. It was sudden.
Sudden. Okay. So can you describe the pain to me? What type of pain it is? Dull, sharp?
I cannot describe it, but it's a very severe pain, doctor. It's maybe I don't know really, but it's very severe, very severe.
Oh, okay. Are you able to continue today's meeting, or do you need painkillers?
Yes, just help me, doctor. I can continue.
Okay, okay. So on a scale of 0 to 10, 0 being no pain and 10 being the highest ever pain, how would you grade your pain?
9.
9. Okay. Okay, so this is the first time this is happening to you?
Yes, it's the first time.
Okay. And does the pain go anywhere?
Sometimes I feel it in my thigh as well.
You feel it in your thigh as well? Is it in the front of your thigh or back of your thigh?
I believe in the front of my thigh.
In the front of your thigh. Okay. And okay. And did you by any chance injure or hurt yourself?
No,
Okay. Do you have any raised body temperature?
no.
Do you have any known medical condition I should be aware of?
I have iron deficiency anemia, and I'm taking iron tablets.
Okay. How long are you taking these tablets for?
2 years.
2 years?
Yes.
Okay. And this pain that you're having, have you noticed anything that makes it worse?
No, doctor. I am not sure.
Anything that makes it better?
I tried paracetamol, but it's not improving.
Okay. And do you have pain anywhere else in your body?
Yes, I feel pain in my both thighs. My back
Both
as
of your
well
thighs?
hurts. Both of my thighs hurts. My back hurts. My shoulders
Okay.
hurts.
Okay. And these back and shoulder pain, they are also for the same duration?
No, doctor. I have been having this. It's not like a pain, but it's more of a difficulty. I have been having this for 8 months. 18 months.
18 months?
Yes.
Okay. Now, so do you have difficulty doing overhead activities?
Yes, doctor, you're right.
Do you have difficulty? Can you sit up, stand up from sitting position without using your hand?
It's difficult for me, doctor. And actually, when I got this pain, I was trying to get up from the chair, and it was very difficult for me. And suddenly, I got this severe pain in my hip.
Okay. And have you received any blood transfusion?
No.
Okay. And anyone said you're getting paler day by day?
Yes.
Okay. So do you have any racing, pacing of your heart?
Yes.
How would you describe the racing, pacing? Is it, can you tap it for me? Is it regular, irregular,
It's a regular one.
regular? And is it present all the time or it comes and goes?
Most of the time, mainly when I walk.
Okay. And do you have any breathing difficulty?
No.
Any cough?
No.
Any swallowing difficulty?
No.
Okay. Do you have any joint pain anywhere?
No.
And any skin changes?
No.
Now or before, like any skin rash anytime in ever?
Yes, doctor, before I had some skin rash, but it's not here now. I took some cream, but now I
Okay.
don't have any
Where was
skin.
the skin rash?
On my elbow.
On your elbow?
Yes.
Was it itchy?
Yes.
Okay. And when was this rash?
Long time ago, maybe 1.5 year.
Okay. And okay, so may I see your medication list?
I just take the iron tablet.
Iron tablet, nothing else.
Nothing.
Okay. Any over-the-counter medicine?
I just took the paracetamol for the pain, which did not work for me.
Okay. Any medicine called steroid?
No.
Okay. And any herbal medicine?
No.
Okay. And sorry to be asking this, any recreational medicine?
No.
Okay. And may I ask you, what about your water work? Any changes in color, amount, frequency?
No, it's normal.
Have you noticed any blood coming out of anywhere in your body?
No.
Okay. And what about your bowel habit? Any changes in consistency?
I have been having loose motions for several
Since
years.
how long? Since how
Maybe
long?
2 years, maybe.
2 years?
Yes.
Okay. And this loose motion, is it, how would you describe your stool? Like, is it bulky, greasy?
Yes, doctor, you are right.
Okay. Is it difficult to flush?
Yes, doctor.
Okay. And this, along with this bowel back passage problem, do you have any tummy pain or tummy discomfort?
Some discomfort is there.
Okay. And which part of the tummy? Is it your whole tummy?
Whole tummy, yeah.
Okay. And have you noticed that it gets worse with particular food like bread, pasta?
Yes, doctor, you're right.
Okay. And have you noticed any difficulty seeing things during the nighttime?
No,
Any hair fall?
no,
Any bleeding under your skin?
no,
Okay. And did you have any episode of red eye anytime before?
no,
Any yellow coloration of your eyes?
no.
Okay. And uh, do you have any okay, I'm going to ask you some personal questions. Do
Mhm.
you smoke?
No,
Do you drink alcohol?
occasional.
Okay. And any changes in your weight?
No, I believe it's stable.
It's stable? Okay.
Yeah.
Any weather intolerance, weather preference?
No,
Any lumps and bumps anywhere?
no,
And what do you do for a living?
I'm a teacher.
How is this affecting you?
Yeah, it's affecting me a lot. I could not go to work today because of this pain.
Okay, we'll see how we can help you with that. And any tingling, numbness sensation, any abnormal sensation anywhere?
No,
Okay. And so you are having pain in your muscle, right?
more of a difficulty. Like,
Okay, more of a difficulty. And do you have any headache?
no,
Any vision problem?
no.
Okay, so I'd like to examine you.
Yes,
Okay. I'd like to check the patient's abdomen for any tenderness,
no tenderness,
any organomegaly, any
no
organomegaly.
no organomegaly,
Okay. And I'd like to I'd like to know the vitals of this patient.
normal,
Any postural drop?
no,
No postural drop. And I want to check for lymphadenopathy.
nothing, negative,
Any rash anywhere?
no,
And I want to check proximal myopathy. Is it present?
present, positive,
Okay. And there is no rash or bleeding under skin, right? I
no.
want to check for anemia.
Yes, there is pallor,
Okay. And any leg edema.
edema, no.
Okay. I want to check the hip joint. Any problem with movement, any tenderness.
Yes, there is tenderness over the hip joint, there is shortening, there is external rotation,
Okay. And I want to check the patient's gait.
waddling gait,
Okay, waddling gait. And okay. Do you okay, I'm going to ask you some more questions. Okay. You said you do not have any tingling numbness sensation anywhere, right?
sorry, what is it?
Tingling numbness sensation anywhere?
Nothing, no,
Okay. And I'm going to ask you, do you have any previous hospitalization?
no,
And any recent surgeries or previous surgeries?
no,
Any recent travel anywhere?
no,
Any mouth sore?
no,
And sorry to be asking this, any soreness in your private part?
no,
And any stiffness in your joint?
no,
And have you come in contact with any sick patient?
no,
Okay. Any family history I should know, I should be aware of?
My mother has a thyroid problem.
Okay. And do you have any weather intolerance?
No,
Okay. And what do you do? Are you able to drive with this condition?
it's difficult, doctor. Because of this pain, I could not drive.
Okay. I'd like to advise you to stop driving until we figure out your condition.
Okay.
Okay. And okay. Any vision problem?
No.
2 minutes.
Okay. Any weakness anywhere?
I just told you, doctor, in my shoulders and my thighs, I feel weak.
Okay, sorry for asking you again. Okay, so what are your concerns?
What's wrong with me, doctor? What's the reason for this severe hip pain I got?
Okay, so from what you have told me and from what I have examined, you most probably there is some loss of your bone mass. Your bone has become brittle. It has become weak because of a condition. It has become weak, and there has been some fracture in your hip bone, and it may have happened because of an underlying condition that you have. We call this celiac disease, and because of celiac disease, don't bother about the term. It's a condition that happens due to your faulty defense system, and it is attacking the wall of your gut instead of the bugs, and as a result, you're losing a lot of vitamins and minerals. So this may have caused you to have this problem.
Mhm.
So I advise you to stop weight bearing, like lifting heavy objects, and avoid gluten containing food like bread, pasta, barley. Okay.
Okay.
And do you have any more concerns?
No, doctor, thank you.
Okay, time is up. Questions? Examiner questions?
Yes. Yeah, can you present your case?
Okay, so Mr. Ali, 35 years old, came with sudden severe pain in his right hip, and he gave history of celiac disease as evidenced by fat malabsorption. And he gave history of iron deficiency. On examination, he has tender hip joint with external rotation and shortening of his hip joint, shortening of his leg, and there is proximal myopathy, most likely due to vitamin D deficiency, and he is anemic. So yes.
Okay. What are your differentials?
I think this patient has fracture of femoral head, secondary to osteoporosis. Yes.
Okay, any other differentials?
Any other differentials? No, nothing else comes to mind. There are other possibilities, but it could be avascular necrosis. Yes, it could be avascular necrosis, and it could be sacroiliitis.
Okay.
though patient gave no history of rheumatological condition.
Okay.
Okay, so these are my differentials: avascular necrosis, osteoporotic fracture of femoral head, and sacroiliitis.
Okay. What's the reason for the proximal myopathy and the waddling gait?
That's because of proximal myopathy secondary to vitamin D deficiency,
What's the name of this condition?
osteomalacia.
Okay. What are your investigations?
Okay, at first I'd like to do X-ray of hip joint and MRI of hip joint, and then I'd like to do inflammatory markers, CRP, CBC, CRP, ESR, and then I want to do anti-TTG biopsy for endoscopy with biopsy to diagnose celiac disease. And I'd like to do CBC to check for anemia and possibly iron profile and possible blood transfusion, and vitamin D levels, calcium level, and serum alkaline phosphatase. Okay, and bone profile.
Okay. Anything else you want to do?
Uh, I don't know.
Any invasive
Okay.
procedure?
I want to do endoscopy with biopsy to diagnose celiac disease.
Okay. How are you going to treat this patient?
I'd like to educate and counsel the patient, form a multidisciplinary team of specialists, including orthopedics and orthopedic surgeon and rheumatologists, dietitians, and other specialists. And I would ensure bed rest to the patient, and pain management for the patient. And okay, the patient may need any walking aids, so, and physical therapy, pain relief, and maybe surgery with femoral head replacement.
Okay. Anything else that you would like to offer?
Nothing comes to mind.
Okay. Dr. Bassem, I would like to ask some questions just for learning, but actually,
Yes,
Dr.
yes,
Razia,
yes. Go ahead.
you did an excellent job. I will ask you just a few questions for learning and just in case you were asked in the exam. What complications of celiac disease do you know?
Okay, patient could be having anemia, especially macrocytic anemia, and then vitamin A, D, and E, K deficiency. Patient could be having malignant transformation and other autoimmune associations like type 1 diabetes, premature ovarian failure. These are associations, not complications.
Any other complications?
Lymphoma.
Yes, enteropathy, T-cell lymphoma of the small intestine. Anemia
Yes,
you mentioned.
enteropathy. Yes.
Okay. Anemia you mentioned. Hyposplenism, don't forget. Hyposplenism, and
Okay,
you
yes.
have, yeah, very important. Osteoporosis and osteomalacia both are complications. And other malignancies like esophageal cancer. Okay, what do you expect to see in the biopsy?
Yes. I think I forgot.
Do you remember villus atrophy?
Yes. And oh,
Yeah.
lymphocyte infiltration.
Yes.
Villus atrophy, lymphocyte infiltration. Yes.
Yes. Villus atrophy, lymphocyte infiltration, crypt hyperplasia.
Yes.
Okay. Do you know any other causes of villus atrophy?
Tropical sprue,
Okay. What else?
Whipple's disease.
Excellent. Okay, خلاص, I will stop questioning. You did very great job. MashaAllah.
I would
What do you...
I would add last question. Last
Yeah.
question. Would you ask this patient to stop the food or
Yes,
continue?
actually, I wanted to ask this question, but I forgot
Yeah.
it. Good
Okay.
you asked.
I thought I advised him to avoid gluten-containing food. I did not.
You did,
I can't remember.
but
My
think of the
question,
question again.
yeah, clinical judgment now. You already advise the patient, but I am an examiner. Would you like to stop gluten-free diet now?
Yes, yes, of course.
Again?
And I would involve the dietitian.
Again, the question, would you stop him?
The examiner is prompting you now.
Yeah.
Yes, I would stop gluten-containing food, not gluten-free food.
Yeah, you will stop gluten, including food. My question, would you
Yes.
start now or after?
Oh,
Yes.
yes.
Okay.
No, after the test,
Yes.
after the test.
Yes,
Yes.
you should not. You should not
Okay.
stop now. Yeah.
Yes, exactly.
Yes,
Okay.
yes.
I am
Yeah.
done now.
Okay, that was yes, that was a
Yeah.
good
Well
question.
done. Yeah. Okay. Great
I
job, Dr.
I
Nadia.
I had no idea that osteoporosis can happen other than back pain, back in the back. Like I was thinking, maybe some steroid use, maybe sickle cell disease or Cushing or some kind of steroid use. I did not know that osteomalacia can also happen in the hip joint.
So let me tell you, the hip fracture can actually be due to osteomalacia, but can also be
Okay.
due to osteoporosis. And here you
Okay.
forgot to examine the back. Actually, it could be a fracture there in the back as well. You forgot the back totally. So the patient told you that I have lower back pain. So don't. So it can be both osteomalacia related hip fracture or osteoporosis related hip fracture, or you can put then other differentials. This patient is at risk of hyposplenism, so maybe infection, osteomyelitis. Although the time period is not going with infection, osteomyelitis, septic arthritis. You can put other differentials, but the top will be the osteomalacia and osteoporosis related hip fracture with an underlying, as you said, celiac disease, as you said. Okay. Now, okay, few comments. You did very well, mashallah. Just in the beginning, don't forget to tell the patient that you're going to examine him. You have to mention that
Yes.
when you take the permission. You did not mention. I think you just ask the patient, how can I help you? Okay.
Okay. I miss the really very small things. I miss a lot.
No problem. With time, we will learn. And in the history, you took a very good history and relevant and targeted questions, but I felt it was a little bit haphazard, especially in the systemic review. I think you should have an approach for yourself. You should cover the main complaint, and at the same time, you can ask the patient any pain anywhere else. Initially, you asked from the pain, and then you went for other questions, and then you asked any pain anywhere else. Then I told you that I have the back pain and the shoulders, and so you can finish the pain all at once and the musculoskeletal system at once and the joints, and then you ask other questions, systemic review head to toe. After asking, better to ask past medical history so that you get idea of what's going on. But your questions were very excellent. Even when you asked about the vitamin deficiency symptoms, hair fall, difficulty seeing at night, it was excellent, really, mashallah.
Thank you.
Okay. Okay, then in the examination, I think you did well, but you should start with the vital signs and any related bedside examination that you would like to do, and then you go to the affected joint, to the main complaint, rather than going. I think you examined. I forgot what you examined, but it was something not the main complaint. You came to the hip joint at last. I think you examined the abdomen or something. You have to examine the hip joint first because it's my main complaint. And then you examine other related parts, whatever you want. So you examine the hip joint here, and important to examine the back because I told you I have low back pain. It might be something serious in the back, maybe back fracture or cord compression or whatever. So the hip and the back, and then you examine the other related parts as you did, from upper limb to check the eyes, to check lymph nodes, to checking the abdomen. And maybe at the end, if you found time, you can listen to the hearts to check for any flow, murmur of anemia or whatever. And proximal myopathy you did. Okay. In the investigations, basic investigations, as you said, full blood count with differential and ESR, CRP, and electrolytes. And the anemia workup is important for late vitamin B12 deficiency. All of this you have to mention. And also the vitamin D, calcium, also important here, and all the bone profile. And for specific for celiac disease, you will have to do the anti-tissue transglutaminase antibody and IgA levels, very important, because if the patient has IgA deficiency, then the test will be negative. And there was something else, anti-tissue transglutaminase and anti-endomysial antibodies, I think, anti-endomysial. Then the confirmatory is upper endoscopy with jejunal biopsies to look for villus atrophy and what we talked about before. For the hip joint, for sure, you have to do the X-ray. Maybe consider MRI as well. And maybe you will do DEXA scan also to check for osteoporosis. Okay.
Yes.
These
I
are
think I
the...
said bone scan, not DEXA scan.
You did not say DEXA scan, yeah.
I said bone scan, yes.
Yes. These are the main investigations. Okay. Then the management, as you said. In the end, don't forget also to offer vitamins for the patient, vitamin supplement. And these patients are at risk of autosplenectomy, so I mean hyposplenism, so don't forget vaccinations. They will need vaccinations, pneumococcal vaccine, influenza vaccine, and COVID vaccine. And the treatment of the underlying osteoporosis, you have also to involve the endocrinology. So you will treat the calcium, vitamin D, and also consider bisphosphonate and others. These are my comments. But you did a great job, mashallah. Dr. Basim, the floor is yours.
Perfect. Preparation by Dr. Ryan. She prepared the case perfectly. I mean, knowledge-wise, this is what we need from the surrogate to prepare the case well for herself. Of course, she refreshed herself now about celiac, and also she helped others. I mean, the meeting, and of course, Dr. Nazia, she got a lot of refreshment today about celiac. Plus, she did it great
Yes.
when she reached diagnosis. But as Dr. Ryan said, you have to be little bit systematic. I thought also the same. You are disorganized from here and there, question from here, question from there. Try to be systematic. She gave you a clue initially about the celiac. She told you I have a rash in my elbow, and you catch it. It's itchy. Yes, it was itchy. This time, immediately screen for celiac, and not only celiac, the other association of celiac or other autoimmune manifestation. Don't wait for her to tell you, my daughter or my mother was having thyroid. You have to screen the thyroid by yourself. You expect that there is some other autoimmune association, right? So you have to screen about vitiligo, thyroid, and diabetes as well, right?
Yes.
Yes.
Immediately, once you know there is possibility of autoimmune in any condition, in any scenario, screen for others. They are coming together, and they like to ask the package of autoimmune together. Even you are in the system view, but you have to screen other. You will be wondering if she told you, doctor, do I have in the concern if you forget in the system view or during the taking history, you will be wondering if, or you will be shocked if she asks you, doctor, do I have a thyroid like my mother? Do I have diabetes like my father? Oh my God, I didn't ask the question for thyroid, or I didn't ask about diabetes. You'll be in trouble. Remember this advice. Any autoimmune associated with other autoimmune, I have to screen all the package of autoimmune profile. Okay. Apart from this, you did great. You reached the diagnosis, the management plan, the welfare. Always remember to say, if you have any pain, let me know. I'm sorry if my hand is cold. Let me know if you are feeling discomfort and so on. Apart from that, in the examination, you did great. Always remember, as Dr. Sarah mentioned earlier, in the investigation while answering the examiner, general investigation, specific investigation, bedside test, and imaging, image exactly, image and advanced options like invasive options, like what endoscopy. Here you kept quiet thinking what I do, and the endoscopy here is diagnostic, right?
Yes.
Okay, I will add another question. I think Dr. Ryan mentioned if you found IgA antibodies is normal, what you will do?
Check for endomysium.
Okay. No, I'm talking
And
about, yes, antibodies.
You said normal, Dr. Basim. You said normal. If IgA is normal.
Yes.
So the problem is if IgA is
Okay.
deficient.
Yeah. Yes. If IgA, the opposite. Yeah.
Yeah.
Yeah, yeah.
Yeah. If
Yes.
IgA is low. Yeah. Yeah.
No.
Yes. So what you will do, Dr.
um,
Dr. Nazia? IgA is low.
How will you confirm or you check for celiac?
biopsy
No, the biopsy is
and
confirmation. I mean,
IgG, and I will
yeah,
check
exactly.
IgG.
IgG. This is the question. This is a tricky question.
IgG.
Also, they are asking this question.
IgG.
Yes, exactly.
Yes.
But the confirmatory test in celiac, definitely the biopsy, endoscopy and vaginal biopsy. The
Yeah, and the
IgA
Yes.
bodies, yes, it can help, but they will not, and they will never skip the invasive or the endoscopy or the vaginal biopsy. So you have to remember this, okay?
also the patient has
Yes.
to be on the gluten diet for at
Exactly.
least 6 weeks
6 weeks.
before
Exactly.
before the test. Yes.
Exactly. And
Yes.
you will not stop it until we finish the biopsy. After taking the biopsy, confirm the diagnosis, now the patient will start to be on gluten-free diet. Always remember the dietitian as one of the team, and the occupational therapist if he has any disability. This patient having limping because of the pain, you have to mention occupational therapist to provide him some aids for walking to cope with his activity, at least with his daily activity. Of course, you can give him sick leave, but at the home, how he will walk. So remember the occupational therapist, the team who are assigned to help the patient in his daily activity, giving them some
Yes.
aids like hearing aids if he's having hearing difficulty, like stick if he's having walking difficulty, wheelchair, and so on. Clear now for all? I guess this, again, as usual, mashallah, Dr. Ryan sessions and cases are perfect. Amazing. So she's.
Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh.
Thank you,
I
Dr.
I
Basim.
have
Mhm.
one question.
Okay, go ahead.
In examination, should I ask patient to walk with this severe pain and we suspect if patient may be fractured? Should I ask the patient to walk to examine his gait? Or
What do you think? I will ask you the question. What do you think? You have
I
to,
think no,
yes,
but
Dr. Zainab, you have to, huh? What to do?
I think we should not ask the patient to walk. So
Okay, try again. Think more.
if
Yes,
we
you would
suspect
not.
fracture, yeah,
Okay, you suspect and you don't want to
yeah,
hurt him or
yeah,
to harm him.
with severe pain, with
Okay,
he
what to
scores
do?
the pain like a night.
Perfect. Yes, what to do?
Yeah. I don't know.
To ask.
Ask him.
Yes,
Ask
exactly.
ask him.
Ask him first, and
Yes, ask him first and take permission for him. If you don't
perfect.
have,
That's it. That's
yeah,
it. You answer it
okay,
by
okay,
yourself.
okay,
So you will ask him, "Are you able?" If he said no, or he said yes, okay. Let's assume he said yes. Now you have to ask the examiner, "Can I
okay,
offer gate?" Why? Because he might do it, but he might also injure himself because he doesn't expect any difficulty, and maybe he will do it like because you are insisting on him. So the best way is to ask him. If he said yes, you offer because you suspect a pain and he might have injury. So you can offer to the examiner, can I do the gate? If he said proceed,
okay,
this time you will proceed. Even if he said or shout or whatever, you got the permission earlier. So you'll not have any minus in the welfare. Clear now?
Also, Dr. Basim, the problem in this exam is not attempting to do stuff because we are worried about the patient. I believe always we have
Yes,
to attempt
exactly.
to do the thing. Yeah.
Exactly,
Ask
yes.
for it. Yes.
Really, yes, you're right.
Yes.
I am 100% agree for that. If you said no, I don't want because he has been, of course you will take good mark with less and minus 3 or 4 marks in the physical examination. Who told you he has been? Okay, yeah, he has been, but why not to proceed for the exam? They will never leave it. Okay, so please proceed, but you have to offer the painkiller, the offer for the patient, any pain, and the last thing, permission from the examiner. But be sure that you will do the test. Okay. Any question else? Any comments? Dr. Nazia, Dr. Ryan?
Thank you.
I can see a lot of comments, all of them, mashallah, informative. Please repeat if IgG. No, not IgG. If IgA is the one low, I will do the IgG, not the opposite. Exactly. Dr. Hatim already answered this. Or sorry, Dr. Rasha. Dr. Rasha asked and Dr. Hatim answered. Okay. Thank you, Dr. Hatim and Dr. Rasha. What are the questions for valid deficiency? Oh, a lot of deficiency. Minerals plus iron plus salts. So a lot of deficiency. And by the way, there is anemia possibilities in celiac. You can have 3 types of anemias. So don't specify only megaloblastic or macrocytic. There is 3 types. What do you think, Dr. Nazia? What other types of anemia here?
Microcytic, macrocytic, and dimorphic.
Okay, macrocytic for folic acid and vitamin B12.
Yes.
What about iron?
Yes.
What iron?
Microcytic,
Exactly. So another
and
type.
also dimorphic.
Yeah, so there is a lot, right? So don't specify
Yes.
only one type of anemia. You might have, and if the patient is having autoimmune, it might be autoimmune hemolytic anemia. It's one of the manifestation of any autoimmune, right? Autoimmune microangiopathic hemolytic anemia, MAHA. Okay, so this is another also presentation of anemia. Okay, the valid question deficiency we mentioned. Yes, let me say also, you can name all the vitamins A, D, E, K, vitamin, which is lipid or fat soluble vitamins, calcium deficiency, iron deficiency, magnesium deficiency, all the minerals deficiency. Name and don't, you will have a lot and don't forget any of them. Okay. Let's go to the next question. Of course, there is alcohol induced here for celiac. Beer, the beer. If you ask here for the patient, if you want to ask and to analyze the relation to the food, you can ask also related to certain alcohol, because this patient will have this manifestation whenever he talk or whenever he take the beer. Okay, because beer is one of the gluten containing alcohol or alcohol containing gluten.
I forgot to say this case came in Diet 1 this year. So
Yeah, celiac, one of the most
common.
highlight. Yeah,
Yes.
we have
It's
to study it from A to Z, from the manifestation, the complication, the investigation, the management. Any diet it can be presented, and every diet.
Yes.
Okay. The other questions I want to read quickly. After serology, yes. Gluten challenge, yes. For confirmatory first, yes, exactly. After 6 weeks, induction of gluten-containing diet to confirm the diagnosis. MashaAllah, all of them answered. Dr. Salma, Dr. Rasha, Dr. Ayman, Shaheen, Dr. Muhammad Sardir. Yes, villus atrophy, of course, you have to do to check for villus atrophy and lymphocyte infiltration. There is a concern always raised by the surrogate. Doctor, any possibility to have a cancer? you have to address this concern. As Dr. Nazia said, yes, there is possibility. I am afraid to say, or sadly, I am afraid to say, I'm sorry to say, there is a possibility. Because as Dr. Ryan mentioned, there is possibility to have lymphoma, T-cell lymphoma, right? So it's a cancer, whatever the type, but it's a cancer. Yeah, hyperthyroidism with celiac, malabsorption. Of course, we will admit because, yes, Dr. Fazlur Rahman, yes, we have to admit because of the severity of the pain. By the way, you might admit a patient only for the severe pain, 5 and above. You might say, I can admit you today, especially if he told you, I don't have any response to any painkiller and so on. And always, Dr. Nazia, if you feel your patient in pain and the pain scale is more than 5, offer him a painkiller. This is always as advice, not only for Dr. Nazia, for all. I don't know if she asked or if she offer for painkiller, but put it in your mind, all of us.
I asked if he was able to
No,
continue the
don't ask in
meeting.
this way. If he said no, I'm not able, what you will do? You will be in trouble.
Yes, right.
Then, yeah. So the best way is, are you in pain now? Yes, doctor, I am. Okay, can I offer you painkiller? Please, doctor. So you act as you are calling for painkiller. Please, can we have a painkiller? That's it. Okay. But don't say, are you able to continue or to proceed? You will be in trouble if he said, no, doctor, I'm feeling pain. I cannot proceed. So what you will do? So the best way
Okay.
is to offer him painkiller and proceed without saying if you are unable. Yes. Okay. I guess we finished the question. Yes, go, Dr.
Dr.
Azhar,
Boss.
go ahead. Yes, sure.
I could not understand this. I'm offering you painkiller. Can you walk? Sorry, I could not understand. Can you repeat?
For the welfare, if you have patient with severe pain, the scale of pain more than 5, you have to offer for painkiller.
Okay.
Okay,
Then
this
for
is the
the we can ask for the
okay.
gate or not?
Yes, for the gate. Patient is having pain, and I want to examine the gate because the gate always one of the steps. It might help in the diagnosis, and it will give me marks if I examine it, right? And it might harm my mark if I didn't examine it. Why? Because this patient is having limping gait because of severe pain or because of the fraction. So definitely I should do it. How to do? I will ask the patient, can you or you are able to walk? If he said yes, and I am guessing it might hurt him or he might be injured if he walk, I will examine the patient, the examiner, or ask his permission. Can I examine the gate? He will of course say yes, or if he doesn't need and the gate is okay, normal, he will tell you skip it. You got it now?
Yes, yes. Yani during history, we can ask from the examiner
About
about. I want to check his gate. Can I proceed?
yes, you can do it like this.
Okay.
Okay.
Dr. Basim, I have a question.
Yes.
What the specific questions to ask about the osteomalacia pain?
Yeah, as Dr. Nazia asked, are you able to stand up from sitting position without help or assistance? If she said no, I cannot, this is osteomalacia, most probably, or proximal myopathy. So are you able to stand up from sitting or no? Or are you able to comb your hair? This is also another proximal myopathy sign. Combing your hair or climbing the stair or standing from sitting position. All the questions are okay for proximal myopathy. And osteomalacia, one of the causes of proximal myopathy.
Oh.
Okay, any other question? Yes, climbing the stairs, exactly. Thank you, Dr. Fazlur Rahman. Dr. Nisma also mentioned bone pain. Bone pain will be more for the calcium and calcium deficiency. And always remember the bone profile, including alkaline phosphatase, parathyroid hormone, vitamin D, and calcium level. This is in any hypercalcemia or hypocalcemia or anything related to the bone profile. Clear? Any other question? Okay. I will thank again Dr. Ryan and Dr. Nazia for practicing today with us. And special thank for Dr. Ryan because she wasn't selected, or she was always, as usual, volunteer, and she gave us a nice case, informative one, as usual also. I guess Dr. Ryan now, mashallah, she's ready for the exam because I
Thank you,
can
Dr. Bassem.
your attitudes, your behavior, taking history, all are perfect, really.
But only problem is that she has to
Manage the
shorten
time.
her history. She
Yeah,
is,
because
Yeah,
the time,
you are
mashallah.
right.
mashallah, she did very well, excellently well
Yeah,
in the first scenario. But only please, Dr. Rayan, only manage the time. Try to finish the
exactly.
history in 8 minutes.
Yeah.
I think
Yeah.
you are
Yeah,
not looking on the timer
I
when
am
you are
looking,
taking.
but I am trying. Sometimes important question, I don't know what to do.
By
What
the
to
way,
cut, what to leave.
you
You are
haven't.
very relaxed. I saw you. You are very relaxed, and you are keep asking question until 14
Yes.
minutes, 15 minutes,
Yeah.
no
Yeah.
problem.
Yeah.
Because
Mm-hmm.
in the exam we have to finish the 8 to
Exactly.
9 minutes. Then the examination, we can take 4 or 5 minutes.
Yes.
Yes,
But
yes, you are
mashallah,
right.
you are doing very well. Mashallah.
Thank you.
Welcome,
Yes.
welcome.
Thank you, Dr. Azhar, as well. Thank you, everyone, for the commenting, for the attendance. Thank you, Dr. Sarah, for sharing your experience. And again, congratulations. We can end the session now. I know it's so late. Of course, Dr. Nazia will not forget you. Sorry for making the meeting late for you. I know it's very late now in your country.
No, we are just having sahari now.
Okay, good. So,
Yes, yes, yes. 4 p.m. 4 a.m. in India.
yeah, it's so late. Sorry, Dr. Nazia, again. So you can take your sahur
Yes,
now.
it's 4:30 a.m.
Okay, take your sahur and pray for us. When, inshallah, hopefully you can
Yes,
also practice
inshallah.
again and again. You are really doing perfect job. See you tomorrow, inshallah, all of you with Communication Day. Good luck to organize. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.